So today we are directly going to your first chapter, community pharmacy, its definition, scope and roles. So what is a community pharmacy? It is defined as a place where the medicines are stocked and dispensed to the patients on a valid prescription and were legally permitted without a prescription, and also offer various professional services that improve the health of the patient. So, from a community pharmacy, a trained pharmacist or a qualified pharmacist can easily dispense the medicines with a valid prescription, and also he is legally permitted to dispense the medicine without a prescription. This means for OTC medicines, over the counter medications, for example, paracetamol, glucosamine, for the medicines which we are using for the minor complaints, the pharmacist can prescribe, or the pharmacist have the authority to dispense the medicines without a prescription, and also offer various professional services that improves the health of the patient. So that what we are going to discuss within a time. Then, what is community pharmacist, or who is community pharmacist? The WHO, World Health Organization, defines the community pharmacist as legally qualified trained healthcare professional who act as a virtual link between the patient and the prescription. So what is the qualification of a pharmacist? He should be a registered D Farm qualifier, or he should be a registered B Farm qualifier. So a community pharmacist should be a registered D Farm or B Farm qualified, and he is also a trained healthcare professional. What are the scopes of community pharmacy? As we all know, the worldwide population is increasing day by day. So, they are finding that the available healthcare services and the available medical services are insufficient for the overall improvement of the health status. So, nowadays, the community pharmacists were paying more attention towards the health of the patient, or the lifestyle of the patient, and the state of patient general well-being. Then coming to the roles and responsibilities of community pharmacists. The World Health Organization listing the below roles and responsibilities for a community pharmacist. The first one is processing of the prescription. So, in olden days, the community pharmacists were just compounding and just giving out the prescription medicines what are prescribed. So, but nowadays, as we already told, the pharmacists are playing a lot of roles other than the compounding and dispensing of the medicine. In that, the first one is processing of the prescription. Processing of prescription means whenever a pharmacist is receiving a prescription from the patient, he has to review and check the prescription for the legality and appropriateness and potential drug related problems in the prescription. What do you mean by legality of the prescription? That whether the prescription is written in a letter part of a doctor, whether the doctor's address, registration number, or name is there, and appropriateness and potential drug related problems means whether there is any drug interaction in the prescribed between the prescribed medications, or just we can ask the patient or whether he was allergic to any medication in his past, so we can check whether that medication is written in this prescription. Like that, the pharmacist has to review each and every medications in the prescription, and after checking this only he can, or after checking this and confirmation that after the confirmation that he got that this medicines are safe for the patient, these medicines are safe for the particular patient, he can dispense the medicines in the prescription. Next one is dispensing. So dispensing means make up and give out the medicines on the prescription. As we already told, in earlier days, the pharmacist has to compound and dispense the medicines in the prescription. But nowadays, already the prepackaged medicines are available, so the dispensing part is become more easy. Now, the pharmacist has to label each item what are prescribed in the prescription, and the label should contain name of patient, his age, gender, and the name of drug, instructions for proper use of drugs, name of prescriber, and seal of pharmacy. Patient counseling. So, majority of the patients, as we are saying, mostly the elder patients who have the concomitant disease. Concomitant disease means who is having more than one disease. They may not be knowing correctly about their, or they may not have proper idea about their drugs. They may not know what drug to take, which drug to take for which disease, when to take this, what is the dose for this drug. They may not know correctly about the drugs. So also, because of the busy schedule of the prescribers, they are also not, because in most of the times the lot of patients were waiting outside for the for seeing the physician, so they are also not able to explain about the drugs to the patients. In this time where the pharmacist has to act, so the pharmacist has to study well about the drugs, and he has to explain to the patient in the time of dispensing about the medicines prescribed. So, a lot of research studies have proved that the positive influence of the counseling in improving the disease management and also improved medication adherence. What do you mean by medication adherence? It is the degree to which the patient is following the instructions about the medication intake. That means whether the patient is correctly taking the correct medication, correct dosage in correct time. And thus, by improving the medication adherence, the therapeutic outcome will be improved and the quality of life also will be improved. The next one is drug information services. It is defined as the systemic approach of reviewing various sources of published literature, evaluating the published information, and provide the suitable answer for request. So, the pharmacist has to review the available sources. He has to evaluate the published information, and then after the evaluation he has to provide correct and biased answer to the request. So nowadays we all know a lot of newer drugs are coming to the market. So the government, they are authorizing the company itself for giving information about their new product to the common people. The companies, what they do, they are always giving the favorable and biased information about the drugs to the common people. So now the pharmacist has to act. He has to review all the available sources about the drugs. He has to evaluate whether it is biased or unbiased. Then he has to give the correct answer or suitable answer to the patient. The pharmacist can use primary sources. Primary sources means peer reviewed journals. For example, BMJ, British Medical Journal, Lancet. Lancet is a weekly reviewing general medical journal. Secondary sources means databases. A lot of databases are available in net. Example, Micromedex, which you will go through the coming years. And the tertiary sources are test books. Next one is health promotion. In virtue of their knowledge, skills and relation with public, the pharmacists are able to educate the individuals about their health and lifestyle modification. This include smoking cessation programs, family planning, participation in vaccination programs, education about deworming and balanced diet. Next one is health screening services. Health screening services plays an important role in early detection of disease. Thus, the patient can know early about the disease and he can prevent the complication of the disease. By offering the health screening services, community pharmacists can also involve in monitoring and managing the chronic diseases like hypertension, diabetes, asthma, etc. This will minimize the disease burden of patient and society. Next one is responding to symptoms of minor ailments. Pharmacist is known as the easy available or easily accessible healthcare professionals to the common man related to the health matters. So in case of minor diseases like common cold, diarrhea, sprains, simple body aches, the pharmacist will be able to give suitable medication without prescription. Consultation to general practitioners. Pharmacists, by virtue of their professional relationship, they can guide patients to the general practitioners for management of medical conditions. If required, pharmacists will provide the drug information to doctors, supply emergency drugs to clinics and nursing homes. In Australia, in consultation with the general practitioner, participate in home medicine review program HMR. This HMR or Home Medicine Review Program is a specialized service offered by accredited community pharmacists. The pharmacist, in consultation with general practitioners, will visit the patient residence. Then they will review the case notes of the patients and the medications to identify any drug related problems and resolve the same in consultation with the general practitioners and educate the patient appropriate. Thus, by the pharmacist will increase the medication adherence and therapeutic outcome of the patient. That is what you mean by a HMR program. So, these all are the roles and responsibilities of a community pharmacist. So, that's all about the first chapter, the community pharmacy definition, scope, roles, and responsibilities. Thank you.